And I hope you all have solved these 25 questions on shoulder dislocation. Very common dislocation. What is the fun in internship? At least one of the night duties you should do in the casualty, how to set the shoulder dislocation. If you have not done, you really miss the real fun of internship, bro. So let's make the great beginning. Shoulder dislocation. It can be anterior dislocation, posterior, or inferior. So you should remember, what is the kind of movement that lead to the anterior dislocation, posterior dislocation, inferior dislocation? Favorite question of the examiner. Abduction, external rotation, make the anterior dislocation. Abduction, external rotation, any forced abduction, external rotation lead to anterior dislocation. Adduction, internal rotation, opposite to that. Adduction and internal rotation lead to posterior dislocation. And any hyperabduction lead to development of inferior dislocation. That is what you need to remember. You'll promise me that you won't forget, right? Adduction, internal rotation will lead to posterior dislocation. So this is how from the glenoid cavity, the head has moved out of the glenoid cavity. Now whenever the head is moving out, head of the femur, humerus is moving out, there can be a bony defect that can occur on the superior surface, or typically the glenoid labrum inferiorly, there can be a bony chip. Accordingly, you have a Bankert inferiorly, hill sac superiorly. In case of anterior dislocation is what you need to remember. So this is another example of a anterior dislocation of the shoulder, right? Now one more example of anterior dislocation of the right shoulder on X-ray. And what is this view, doctor? This view is called the AP view. Whereas this view is called the Y view. And on the Y view, this is how you can be able to demonstrate the presence of anterior dislocation of the shoulder is what you should remember. So, what is the attitude of the patient when he presents to you with shoulder dislocation? If it is an anterior dislocation, patient will have his arm in abduction, slight abduction and external rotation. In anterior dislocation, after the dislocation, subcoracoid, below the coracoid process is the most common location. Then preglenoid and subclavicular is least. But subcoracoid anterior dislocation is the most common subtype of anterior dislocation of the shoulder is what you should remember. If it is a posterior dislocation of the shoulder is difficult to diagnose. Why? Because the shoulder's contour is not affected if there is a posterior dislocation. Whereas in anterior dislocation, there is a flattening of the shoulder contour. So when you clinically examine the patient, anterior dislocation is easy to recognize because of the flattening of the contour of the shoulder, lateral contour of the shoulder. Whereas posterior dislocation contour is normal. That's the reason difficult to diagnose. So in posterior dislocation, patient will be holding the injured shoulder in the internal rotation and the examiner cannot externally rotate it at all That is a posterior dislocation.